Hi, I'm Caitlin Doherty, and this is my capstone poster presentation on the role of a professional nurse. For this case study, the patient that I had chosen was a micro-premature infant who was born at 22 weeks and 6 days, weighing 310 grams at birth due to worsening HELLP syndrome in mom. The patient was born via cesarean section and brought to the delivery room intensive care unit where baby was intubated at 5 minutes of life. Once stable, the patient was admitted to the neonatal intensive care unit for extreme prematurity, respiratory failure requiring intubation, respiratory distress syndrome, and the need for further observation and evaluation for neonatal sepsis and being small for gestational age. Upon physical assessment of the patient, it was noted that there were normal and abnormal findings which led the medical staff in making decisions concerning the diagnosis, treatment plan, and interventions of the patient. Neurological observations and maturity were appropriate for gestational age. Assessment of the cardiovascular system consisted of dependent general edema. In evaluation of the respiratory system, it was assessed that breath sounds consisted of bilaterally fine, coarse crackles, which improved with suctioning, and respiratory efforts that were dependent on a ventilator with spontaneous breathing over the vent. The integumentary assessment showed stork bites to the back of the head. During the assessment of the abdomen and the genitourinary systems, it was observed that there was genital swelling and a round, soft umbilical protrusion or hernia present. Observations of the ears, nose, and throat displayed a full fontanelle with separated sutures and mild edema around the eyes. In addition to physical assessment, several labs were drawn during the shift, which included a few abnormal levels. Notable lab results include those listed in Table 1 on the poster. These results were important as they showed a response to a high PCO2 level, causing the base to compensate for the abnormality in the blood gases. Conducted from the patient's current status and medical team, there were 3 priority nursing diagnoses that were identified. First, impaired gas exchange related to the need for mechanical ventilation as evidenced by abnormal breathing pattern. Second, imbalanced nutrition less than the body requirements related to insufficient dietary intake as evidenced by gavage feedings. And third, the risk for ineffective coping mechanisms related to high degree of threat to infant. For nursing diagnosis 1, the short-term goals were to maintain oxygen saturations within ordered parameters and wean ventilation as tolerated throughout the duration of the shift. The long-term goal consisted of weaning off ventilation with the overall result of extubating and breathing on room air with no spells by discharge. For nursing diagnosis 2, the short-term goal was to tolerate gavage feedings as ordered while maintaining blood sugar levels within normal limits during the shift. The long-term challenge is the patient to bottle and or breastfeed ad lib with adequate weight gain by discharge. For nursing diagnosis 3, the short-term goal was to disclose coping mechanisms with life stressors prior to the birth of a newborn baby by the end of shift, and the long-term goal is to be able to provide day-to-day cares for baby and experience life as new parents by discharge. Interventions for nursing diagnosis 1 first include having a trained level 3 nurse assigned to the patient. Assigning the appropriate staff to the patient is critical as not all staff on this unit are trained to be responsible for patients with this level of acuity. The intubation was placed at 5 minutes of life with the reason being that the patient was unable to breathe without support. The patient was then 11 weeks old and still intubated at the time. Throughout hospitalization, nursing staff would adjust the FiO2 percentage in attempt to either maintain adequate oxygen saturations or wean patient to safely tolerate new levels on the ventilator. In addition, the nursing staff and or respiratory therapists were frequently required to suction the patient to eliminate secretions and maintain a patent airway. Oral hygiene and repositioning of the patient were correspondingly completed every 3 hours to diminish the possibility of the patient developing ventilator-associated pneumonia. Interventions for nursing diagnosis 2 were to increase the calorie count in the donor breast milk. Increasing the calorie count greater than the average amount of calories in breast milk was designed to promote adequate growth, development, and weight gain. Due to the recurrent low blood sugar draws performed previously, readings were done over 90 minutes to stabilize blood sugar levels and allow proper administration of nutrition. Interventions for nursing diagnosis 3 include providing the patient and family with an environment that aids and promotes suitable coping mechanisms. The Child Life Specialists are a department within this facility that can be consulted to provide support and be a resource for family members throughout the hospitalization of a loved one. With this resource, along with the nursing staff, it is crucial to allow the family opportunities to converse and express concerns through compassionate and therapeutic communication during these challenging times. Additionally, it is important for the medical team to provide emotional support through acceptance and encouragement when dealing with unpredictable situations during hospitalization. Throughout the medical team's collaborations and interventions, the patient had been successfully stable. Interventions that were effective for the patient's stabilization included sectioning to clear secretions from lungs, adjusting FiO2 adequately to slowly wean the patient off mechanical ventilation, administering of latch feedings over 90 minutes to allow for weight gain, growth, and stabilization of blood sugars, consultations with Child Life to minimize stressors, and compassionate and therapeutic communication by nursing staff. As the health status improved and remained stable, the desired outcomes and goals for the shift were achieved. Thank you for watching my capstone poster presentation.